So just to give a little bit more of a background about me, please call me Kristie, by the way. I'm very informal. My teaching, research, and practice interests all revolve around mindfulness-based interventions, specifically for that with education, mental health, and healthcare populations. So my interest in mindfulness came about organically, just as probably as it has for most people who practice, from very stressful situations in the workplace. I was a school social worker, as Hugh had mentioned, and education certainly has changed since then. And what's really interesting is in the past 3 years that I've been presenting to different school districts, to healthcare centers and mental health organizations, the theme of that has changed from helping to facilitate knowledge about applying mindfulness to our students, clients, and patients, to helping to apply mindfulness-based interventions, also known as self-care, for the professionals themselves. And as I'll talk about a little bit more later, what's interesting is that first responders, for example, are probably most well known for the amount of stress, the type of stressors that they have. We had a horrible incident that happened on Friday with the Aurora shootings. I was at AU at that time, so it was just 8 blocks away. It was insane of what was happening around the chaos with the police and the helicopters. It felt like being in a movie set, to be quite honest. It was very surreal. So we kind of think about like stressors with jobs having to do with first responders, and also secondary traumatic stress, which is actually a form of post-traumatic stress disorder. And we think about those populations as being the most susceptible to secondary traumatic stressors. The untalked about populations are really that of educators. And so I'm here just to kind of talk about how to prevent, of course, secondary traumatic stress, but also to help facilitate different types of self-care measures that aren't going to take more of your time, that are practical, and also that you can use for your student populations. Because the last thing that you want, I'm sure, is more time that you have to commit to doing something else. So a lot of the things that we're going to talk about today are things that you can incorporate really without having to take more time out of your schedule to do so. Certainly you can do that, but also how to incorporate mindfulness practices for self-care as you're living your life. And those are more of informal types of practices. Does that make sense? Does that sound good? Okay. Please feel free to ask questions and provide feedback throughout our hour today. We have a lot of information to cover, but what we don't cover is fine because you've got the slides. And if you have any questions about anything that we covered or didn't have a chance to get to, feel free to email me. I have my contact information on the slide. Hugh has my contact information. I really enjoy this process, so you wouldn't be bothering me at all to contact me through any of my numerous emails, website, whatever it might be. Okay, thank you. Okay. So we're going to begin, if you will, with a brief body scan. Okay. So if you'd like, find yourself in a comfortable position, whatever that means to you. Okay. It could be the position that you have right now, or you could have both feet on the floor, or maybe you want to cross your feet or lean up against a chair or a table or what have you. There's no prescribed way for comfort. You could have your head on a table, whatever that might be. Okay. And you can close your eyes or lower your gaze, or perhaps find a fixed point, just so vision becomes one less distraction. Not having your eyes open is always a perfectly good option. And if you like, just begin to focus on the breath. Not doing anything necessarily to change the breath or the rate of breathing, but just observe the breath. And taking a perspective of that of an observer. So just noticing perhaps when the air enters the tip of your nostrils, moves down the throat and into the lungs, deep into the diaphragm. Perhaps you're noticing the chest or the belly rise and fall. Kindly consider observing that pause between the in and the out breath. And notice that point of exhale, perhaps the urge or just the natural tendency to exhale. And then the air moving back through the same route in which you first were inhaling. Notice, if you will, the amount of air that you're taking in, holding, and then letting go. And again, that pause between the out and the in breath. If you like, just gently and kindly shifting your awareness to the bottom of your feet. And again, I encourage you to take the stance of that of an observer, of just noticing and observing. Noticing any sensations, any tightness, any pain, any feelings of relaxation on the bottom of your feet, on the right and the left side. Shifting up to the top of your feet, toes, joints, tendons, ligaments, the ankles, the inner and the outer ankles. And just gently shifting the awareness up the shin bone, to the knee, and around the back, to the calf muscle, and then down back toward the ankle, the Achilles tendon. Again, just noticing anything with curiosity. Anything that's coming up, you might notice your feet touching the floor. You may notice the clothes on your body. You may notice some sensations. If it helps to wiggle your toes, feel free to do so. Feel free to tighten any muscle and relax if that helps throughout this process. And kindly and gently, again, bringing awareness up to the thighs, the quadricep muscles, into the hamstring muscles, up to the glutes, again, on the right and the left side. You may notice, again, your weight on the chair, a bend in the knee, stretch perhaps in the quad, maybe tightening in the hamstring. And just through your awareness, finding your spine, finding the bottom part of the spine. Perhaps you're feeling that as you're sitting on that area, and just gently walk your awareness up the spine one vertebrae at a time. And as you're doing so, consider just shifting your awareness from right to left, on the left side of the spine to the right side of the spine as you make your way up toward the neck. Paying special attention to any areas of tightness or lightness, the shoulder blades. And then just landing the awareness on the back of the neck. And again, just scanning that area and scanning the tops of the shoulders. And consider shifting the awareness down both the right and the left arms. The front of the shoulders, the back of the shoulders, down to the biceps, triceps, to the elbows, to the crease in the elbow, down the forearms, front and back, to the small bones in the wrist, to the back of your hands, the tendons, ligaments, muscles. Between each finger, just tracing your hand like a child would trace their hand to make a turkey. Just tracing your hand. Again, just focusing on what it is that you notice. If you begin to notice thoughts or other distractions throughout the practice, maybe something that you're hearing, maybe thoughts are coming through, perhaps judgments, perfectly normal and acceptable. Just notice, maybe label it, sound, feeling, maybe you're noticing hunger or feeling itchy. Just observe those reactions and kindly and gently returning your attention back to the practice. Moving the awareness back up the right and the left arms. Coming again into the neck area, just moving to the back of the head, to the top of the head, the temples, behind your eyebrows, your right ear, your left ear. your right side of your jaw, the left side of your jaw, your teeth, your gums, your mouth, your lips, underneath your tongue, the chin, down into the chest area. Perhaps you can notice your heartbeat. And again, you may notice a rise and fall of the chest with the breath. Shifting awareness to the lower abdominals. And again, here you may notice the rate of your breathing or digestion. And starting or ending where we began with the breath again. Perhaps noticing any similarities or differences within the breath, within your thought process, within your physiological state. And when you are ready, and understand what that means for you to be ready, come back to come back to your body, back to the space that you occupy, back to your colleagues, back to the library. And feel free to open your eyes if they're closed, and tend to whatever needs might come up at this time. Probably a sip of water, readjusting, maybe moving clothes around a little bit. So that was about a 3 or 4 minute body scan. Is this a familiar practice to anyone? Okay, fantastic. Body scans can go anywhere from a quick 30-second practice to like an hour and a half. Like, I don't know who's got time for that, but hour and a half, long practice. I would be falling asleep well into a body scan that was that long. But a body scan is one of those mindfulness 101 types of practices. It's an evidence-based practice, which are all of the practices that we're going to be talking about. And how I define evidence-based is evidence that has shown over a long course of time to be an effective practice given a certain population. So this is a mindfulness 101 for a mindfulness-based stress reduction class, which is one of the main practices that are facilitated during that time. These can be modified with language for however best suits yourself or best suits your students. Apps are great for this. I like Insight Timers, my personal favorite one. It's free, and there's just a ton of different options, and there's several also for kids. All these are listed within the resource section of the PowerPoint presentation, so you all have access to all of that. So, any feedback about your experience with that?
I can't really do it.
Yeah, to talk about, would you mind talking about that a little bit?
I don't know.
It's hard. Yeah, absolutely. That's why they call it a practice, to be perfectly honest. And we'll kind of get into the nuts and bolts of it. But did anybody else struggle with the body scan? Okay. And sometimes you will, sometimes you won't. Sometimes as a seasoned practitioner, we'll struggle through and it'll be a really difficult practice. It also will depend on what is happening. Like, this is the end of the day for you in the middle of a really busy week. And it's that time of the year in the schools. So oftentimes, like, getting in alignment with some of these practices can be really hard. But the good news is, and I love this, is anytime that you're distracted, whatever that might be, or struggling through a practice, but you keep on it, you keep bringing your point of focus back to whatever your intention is, that's the strengthening of the practice. That's actually the practice. So it's very much like when you go to the gym and you're working out and let's say you're going to work on biceps, for example. Like, when you're wanting to get stronger, you don't just curl one bicep and darn, I'm ripped now, right? I mean, we wish. I mean, you got to 3 sets of 15 or 12, with ascending or descending weights, so much time between each set, depending on kind of what your philosophy of working out is, then 3 to 5 times a week. So mindfulness practices are the same type of thing. So every time the mind is distracted, and I wish there was another word for distraction because that implies sort of a negative thing. But every time the mind is distracted and you pull it back, like whatever that moment is that you remember that you've gone off, into whatever you have next or conversation you just had or what that might be, and you pull your attention back, that becomes the practice, and that is what strengthens mindful. That's what strengthens your attention. And mindfulness at its core, at its root, is an attention practice, because that's the first region of the brain that is impacted with mindfulness, is part of the prefrontal cortex. And so when you're practicing mindfulness, you're practicing attention. And obviously there is a strong implication for attention in the school system, I would think. Still, right? Yeah, okay. So thank you for sharing that. So mindfulness defined. So I like to do a practice first, because I think that helps to kind of frame what we're going to be talking about, and to put it into context. So mindfulness, as I'm defining it, so our operational definition is moment-to-moment, non-judgmental awareness, or paying attention on purpose with non-judgmental awareness. And you may have noticed judgments coming through. And it's not to say that your practices won't have judgments, but it's recognizing when those things are occurring. Oftentimes I will do a raise in activity, but it takes up too much time, because it's about 10 minutes, and I didn't want to take 10 minutes of our 16 minutes together to do that. But the resources are available for you, and I'm happy to talk to you about that or share that information. Oftentimes people are judging, like, this feels really silly. Like, why am I taking 10 minutes to eat a raisin, kind of thing? And which is a really normal response for kids and adults. There's always one or two people who are laughing the first time that we're engaging in that practice. So mindfulness is observing what those judgments are, and then again, coming back to the present moment, coming back to what we know is realistic and what is really happening within that moment's time. Mindfulness also is an umbrella term, okay, it's for this moment-to-moment non-judgmental awareness. Meditation is a practice within mindfulness, okay, or different types of meditations are different mindfulness practices. So you just engaged in a brief body scan, which is a formal meditation practice. Okay, any questions so far? Okay, so a part of what I do at Aurora University is, of course, I teach a class specific to mindfulness for clinical social work, and I'm also a researcher. And some colleagues and I completed about a year ago the largest mindfulness study in schools to date. It's actually 120 pages. It's a Campbell collaboration review. And it's a systematic review and meta-analysis, basically, of all of the mindfulness studies that have gone on in the school system, like, that are experimental ever. And so we took this data and we collated it, and we found several different types of results coming from the mindfulness studies. So this is just an example of some of the outcomes that can be expected. This is specific to our kids. These are things we already knew about adults, because research with mindfulness was occurring for adults well before it was with kids. In fact, there was a lot of, one of the main reasons why we decided to do this research is because you might have heard recently, it's being talked about a lot right now, like within the past few days, is that some countries within the United Kingdom are making mindfulness compulsory part of their education. They use a program called .B, and a friend of mine actually spoke in front of Parliament about, like, the effectiveness of mindfulness. But we were hearing about this about 2 years ago when we started this research study, and I was the only researcher in this team that actually is a practitioner of mindfulness. The other three could care less. Like, they don't care about mindfulness. They care about research. So it was nice because there was no bias allowed within this research study. So, but we want to make sure that what we're putting our monies toward, what we're putting our time toward, is actually something that the research supports. So I think the idea of mindfulness is a great idea, right? But where was the research to really support that this was something that was effective with kids? So we decided to go ahead and do that. And we found several different outcomes that were effective for kids. And again, it's here because it works for both students or kids as well as adults. So just a couple of things that I want to highlight here is that notion of reducing the attentional blink, okay? And our attentional blink as adults as well as kids seems to have gotten a lot shorter than it used to be. And part of that is sort of the training that we have with technology. Like technology sort of training us to have these really short attention spans where we feel compelled. Like literally, as I'm teaching class at the university, if I'm checking my phone for the time, I then see several students picking up their phone. It's almost like a contagious yawn. Like if I won't do that to you right now, but if I was to yawn, you know, everybody like kind of having a sympathy yawns, right? That's what happens with technology. I look at my phone and then all of a sudden several students are then checking their phones. Did you? Yeah. Yeah. Oh, yawn. Sorry. I should have said the Y word. So the other piece is distinguishing the narrative chatter of ongoing sensory flow to metacognition to the present moment. So we always have like this sort of narrator in our minds, right? It's always kind of going and narrating what's happening. It's judging, it's thinking, it's future focusing, it's thinking about the past. And oftentimes sort of this voice is going and we're really not aware of that. But mindfulness helps us to be able to distinguish that narrative chatter to metacognition. So of course, the process of thinking about thinking, but whatever that task is at hand. So it helps us again to bring us back to the environment, so our learning environment or within ourselves and our own self-care. And then here again are just some other, some good outcomes. I won't go over all of them. Okay, so some basics of mindfulness. It is not a relaxation practice. That may end up being the outcome. So a lot of people think sort of on the surface that kind of the typical like sitting in lotus position and the hands and that person is trying to relax. They might be, but what's actually happening is that whole series of what you experience during our 3 or 4 minutes of a body scan of actually a very busy mind in general. Kind of think all of this, again, that narrative chatter going through our minds, thinking about the student that we just escorted onto the bus, thinking about our own kids that are at home and what we're going to make for dinner tonight or whatever that might be. And then, oh, I'm supposed to be doing this. Oh, yeah. Or I don't really feel anything in my knee. My knee. Oh, that reminds me. I've got to do laundry when I get home. And we find sort of that whole, you know how that is. Like our mind just starts to go off into other types of directions. So it's not terribly relaxing in the moment. It can be, but that's really not the intention or the focus. But again, some good news. When you're practicing, that generally is the result. If you're having a stressful day or a stressful moment, you may or may not be feeling particularly relaxed when you're done because that's sort of your state of mind, okay? But the cool thing is that it does have cumulative effects. So as you practice these types of meditation practices and make it a part of your life, you will find that when you are going to practice either in a formally or informal way, that whatever those cues are in your mind that you create, like how I always say, find yourself in a comfortable position, whatever that means to you. So when I cue that to my students or to the classes that I'm teaching, to them that automatically means, okay, I'm getting into a place where I'm going to feel a little bit more comfortable, and bringing that, it makes it just much more conducive to relaxation, if that makes sense. If you're only practicing mindfulness when you're stressed, then that is going to be what your brain is going to associate that with. So it ideally will be applied during times when you are calm, which you will find is going to be a more pleasurable experience, as well as those when you are more when you're finding to be a little bit more stressed. Okay. Again, as I had mentioned, the practice of attention and focus, and there are things as formal and informal practices. So as I mentioned, the body scan is a formal practice, and formal practices are those that you carve time out for to practice, okay? So again, going back to the gym analogy, it is you're taking time out of your schedule to work out, let's say, okay? Whereas informal practices are those that you build in throughout your day. So that would be like parking a little further away from the building as you're walking to the building, for example, or taking the stairs instead of the elevator. So you're trying to get a little bit of exercise and a little bit of movement in while you are engaging on the regular activities of your day. Does that make sense? Okay. Both are equally important. Okay. So non-judgment and not judging the judgments. Okay. So again, part of the practice of mindfulness is to be aware of those judgments that we are having. And I'm here to tell you that judgments are one of our main sources of suffering, of stress, are the judgments that we have about ourselves, and about what our situations and things like that. Because when we're judging something, oftentimes we're applying a stressful criteria to whatever that might be. And oftentimes we're either focusing on the past or we're focusing on the future and not necessarily to what is happening within the here and now. Does that make sense? So for example, one of the main populations I work with are people who are impacted by cancer, for example. And cancer treatments and post-cancer treatments can be very painful. Okay, I volunteer at Waterford Cancer Resource Center. And so a lot of the different treatments end up causing problems, end up causing people to have a great deal of pain. And and this is super gratifying for me. And what I will hear from the participants when we're engaging in formal meditation practices is that those are the moments when we're actually focusing on the pain where they're experiencing the less amount of pain that they have, like all week, or since they're engaged in their own practice, or since we met the last time. That's because they're taking that observer mindset and being curious as opposed to judging the pain and saying, why me? Which is actually a really good question. Like, why me? Why I'm the one who's impacted by this? Okay. But when you're like, this is never going to get better, or now I'm going to, then our mind, when we go into that anxiety mode, then like, oh, what's going to end up happening? I'm going to get my leg is amputated. And then for people who have cancer, who have life-threatening illnesses, you can't help but to already then start to plan your own funeral type of thing. So mindfulness keeps us present. It keeps us from going into those, to activating our stress responses. And when we realize that, it gives us a methodology to be able to bring it back to the present. Does that make sense? Yeah. Any questions so far?
I have one.
Yes.
You might cover in a minute, but when you mentioned, you put up the menu earlier about the benefits, and I bet you most of us in the room are saying sign us up, both for our kids, our students, and ourselves. And you mentioned cumulative, but how many hours a day or minutes a day do we need to do that body scan or whatever that is before we're going to start reaping those benefits?
We don't know. We don't know. But what research is pointing to is about 20 minutes per day. Okay. And that's a combination of either informal or formal types of practices. But we don't really know. But what we do know is that it seems to be over a course of 8 weeks. So when you incorporate mindfulness as a regular part of your routine for 8 weeks, you will begin to notice some significant differences. With mindfulness-based stress reduction classes that I teach, and this isn't just like because I'm teaching them, like this is something that's reported typically for most people who experience MBSR, myself included, when I took an MBSR class, is around 4 weeks. You start to experience some of these like, moments, like this interaction with the student would normally bother me, but now it's not. And I'm not exactly sure why. And I found myself like literally having these conversations with myself, like, why are you not bothered by this? I don't really know. Maybe I shouldn't question it, and because it might go away if I think about this too often. Okay. So that's what we end up finding is around 4 weeks or so, you start to notice some of the benefits. Then it becomes more cumulative. You keep up with it for 8 weeks. Generally, most people are reporting significant differences in their stress levels, as well as their perceptions of feeling content with life. Okay, even for people who have significant life stressors. Okay, yeah, thank you for asking. Okay, so then there's this notion of letting be, and I want to make sure that I covered this today. This is one of my favorite things, and this is one of the things that I think if someone told me, I wouldn't have, like, I hope you will listen and understand this, because if someone would have told me this, I probably would have been like, eh. And then it's kind of those things that you learn from practice. So I hope that I can make it resonate a little bit with you all. So we know about when we even tell ourselves, like, just let it go, right? Like, let it go. Like, that interaction with that student or that parent just happened, like just let it go. And as you're telling yourself, you might even be feeling more worked up about what's going on. And then when realizing that you can't let it go, and then it's just like, no, I can't let it go. Now it's in my head. And now I'm bringing it home with me, and now I'm talking about it, and I don't want to talk about it. Okay. Oh, yeah, exactly. Yeah, right. Then it's even worse, right? It's like someone telling you to calm down, right? Like, calm down. Right. Oh, please. So letting it be is when you have something that isn't realistic for you to let go. And you know what this is because you probably already tried to let it go. Okay. So instead of letting it go, you say to yourself, I'm going to let it be. Like, I see you, stressor, email, a parent, whatever that might be. I see you. Yeah. And I'm going to deal with you later. Okay. Here's the thing, though. Here's the piece that nobody would have, that was missing when I was first learning about this. You have to actually go back to it. Okay. Because you know if you're lying to yourself. Okay. So if you're like, all right, I'm going to let it be, and I'm going to come back to it with like, okay, I'm coming back to you, like, and you're just sort of like, yeah, and you kind of know, but maybe you don't know. Okay. If you don't come back to it, it's going to get bigger, and it's going to get a little bit uglier from where it started. But if you let it be and you actually come back to it at a better time, and then you're like, okay, now I'm going to look at you, I'm going to examine whatever this thing might be, you will be in a much better place for it. And probably whatever the ugliness of it is going to become a lot more realistic in order for you to deal with. Does that make sense? And sometimes you might actually be able to let it go. So letting it be. But you, again, the key here is you have to acknowledge it and then come up with a plan of when you're going to come back to it, and then actually come back to it. Does that make sense? Okay. Any questions? So being gentle on yourself. Oh, teachers. So being gentle on yourself is one of those things that I think is easier said than done. And there's a whole new realm of research about this, self-compassion research by Kristie Neff, N-E-F-F, from the University of Texas at Austin. And she's a psychologist, an educational psychologist, in fact, and she's come up with this self-compassion research. And what it really is just understanding that we are here on this earth having a human experience. And it's okay to be gentle on ourselves when we are feeling stressed, when we are activated, and maybe when we are activated to the point where we don't want to be dealing with the stressors that we're dealing with or how we dealt with a stressor. But instead, being gentle on ourselves with kindness and compassion. That, again, is a practice within itself, okay? And there's an ending practice today, which is a loving kindness practice that goes with that, that goes along those themes pretty well. If you're interested in that, I highly recommend Kristie Neff's book on self-compassion. Yeah, she actually just came up with a workbook. I think that was released over break. Releasing expectations is another huge one. Now, I know, again, it's easier said than done, especially when there are expectations around you all as teachers and ever growing. Okay, I understand that. But releasing expectations is doing what you need to do, doing the amazing job that you do, and then that's it. Releasing your expectations for acknowledgement from a parent, for example, right? We know if we're searching for that, it's probably not going to happen, right? Education is, it's a thankless job, okay? So releasing those expectations for what you're expecting for other people, and also releasing expectations in terms of what it is that you can control or manage is a word I like to use a little bit better, a little bit more frequently than control, what you can manage and what you cannot. Because we really barely can manage ourselves and control ourselves, let alone that of someone else's reaction, if that makes sense. So releasing those expectations isn't going to make you softer. It isn't going to make you perform as a teacher any less. Like, you're still going to be doing an amazing job, but it's just releasing those those walls that we build when we have expectations around what a task is, or a performance, or a conversation, or really any type of stimulus, if that makes sense. So like preparing for this presentation today, for example, like, I really hope that this resonates with you. And I really worked hard and talked to Hugh and talked to some other colleagues and used other presentations that I've done to try to create something good that I can fit into an hour period of time. Okay, I really hope that I did it. But I don't know if I'm going to meet each and every one of your individual expectations. I would really like to, but I can't tie myself to that, because first of all, how will I even know, if that makes sense? Unless you all send me feedback. Nope, you did, you did, you didn't, you did, you didn't, if that makes sense. So I do the best that I can. And I hope that the feedback that I get will make it a little bit better the next time, if that makes sense. Okay. Questions? Okay. And as I had mentioned before, working with distractions of the mind and the body and the environment is the practice. So just knowing that, again, part of what's happening. So that also goes into part of informal practices. So while you are teaching, while you are with your students, while you're having a conversation with them, if you start noticing that your mind is going into like, what is that you're going to be saying next, or maybe jumping to getting to the gist of it, for example, staying present with where you're at and where the conversation is with that student in that particular moment. It just takes a second to do that. And we've got a really good practice that I will show you shortly, called the stop practice, that kind of helps us to regroup within that moment. But those are things that we can be doing on an informal basis while we're working, and also bringing that home as well. Because the stressors that we have, it would be great if we could, like, I have this here and I go home and everything is great, rainbows and unicorn and glitter, whatever, right? But we are the same people, whether we were in this environment and then 15 minutes later, an hour later, however long it takes you to get home in Naperville traffic, you were when you left the building, for example. So being able to, like, okay, I'm staying present, I'm staying with what's happening within the moment, and then letting be helps to aid kind of that bit of healthy separation and detachment from the process, even while it is happening. Does that make sense? Okay. Okay, so I'm going to skip to the stop practice. Okay, so again, find yourself in a comfortable position, whatever that means to you. Could be exactly where you are, could be shifting around, and just kind of exploring that. If you need to take a stretch or take a drink, whatever that might be. Okay, so I'm just going to ask that you stop what you're doing. Okay, and take a few breaths, some conscious breaths. Decide if it's going to be through the nose or through the mouth, or a combination of in the nose, out the mouth. Shifting the focus to observing. Try to notice at least one thing within your 5 senses. Notice something to observe through sight. There's a multitude of things in here, so just focusing on one thing. Noticing a sound. Noticing with a sense of touch. Could be your clothing, the floor, the temperature. Noticing something through the sense of smell. It may just be the scent of the air. And noticing through the sense of taste. And coming back together and proceeding on with our talk today, okay? The stop practice can be, and kids love this too, by the way, and you can like create a whole unit around the stop practice. It can take 5 seconds where it's just literally stop, take a breath, observe, again, through the sense of sight. And our sight is the most connected to our amygdala and to our limbic system. So that's also And we're evolved species in that way because our sight is often what's tells us if there's a threat in our environment or not. And then proceed. You can use natural cues in the environment, say a stop sign, even, to practice the stop practice. I find it to be much more effective for transitions. Like I really love doing the stop practice for transition. So in fact, before we started here today, I did a stop practice just because I'm always a little nervous. I'm just like, okay, just regroup, stop, take a breath, observe what's going on, and proceed. Or you can draw this out for being a longer period of time. You can make particularly the take a breath. You can take several breaths, and the observe. You can, again, go through all 5 of the senses or just focus on one. Okay? Questions about that?
So you do it before you do a transition?
Yeah, absolutely. So I actually did it in my class with students at Aurora University. Because even adults, we know we need transition time as well from whatever they were dealing with before they got to class. So we'll often start with a stop practice, and it just helps to disengage from whatever that was and to be able to focus on what we're doing in the here and the now. So mind and body connections to stress. So you probably know a lot of this already, so I just want to go over a few of the high points. So our stressors are generally those things that are external, although there are some internal stressors that can happen with our thought process actually can be a significant stressor, especially judgments, but also pain also can be a source of stress, for example, both physical and emotional pain. But stressors, by and large, are generally those that are external. And usually all sources of stress are things that we really cannot manage or we cannot control, okay? So say we have some type of a stressor. After the stressor, there is a cognitive process we have about that stressor. So we have thoughts about it. Oftentimes they're in the form of judgments, like, why does this have to happen? I don't understand why they're emailing me at 5 o'clock on a Sunday. I don't want to do this, whatever that might be. There are a lot of times those come in the form of judgments, okay? And through the thought process, then we experience some type of feelings or emotions, okay? And this is where the mind and the body, which is all one unit, obviously, where it really begins to engage. Those things that we think about impact our physical being. We feel our feelings throughout our body, particularly within our internal organs. We feel it, of course, in our mind, but we also experience it within the chest and the stomach area, okay? And so those emotions and also, again, other types of physiological responses occur as well. And those then relate to different types of behaviors. Again, can be external or internal types of behaviors. Then we have our coping. So kind of what you were mentioning before, Hugh, coping can be being at, I don't remember what restaurant you had said, but like to bottoms up or with wine and chicken wings. Coping can be working out at the gym. It can be making sure you get enough sleep. It can also be drinking too much, yelling at someone, traffic. A lot of times we take out our frustrations with traffic. I personally take my frustrations with insurance companies. I wait till I'm in a bad mood when I have to call insurance companies because then it's actually easier to deal with at that point in time, okay? Coping is neither really a positive or a negative thing. They can be, but coping is just how you're choosing to cope with a particular situation. All of this then relates to our health, our immune functioning and our health outcomes, okay? So, which also kind of goes even to adverse childhood experiences. I think everybody is familiar with ACEs and the original ACEs study from 1998, which only more research over the past 21 years has continued to demonstrate how significant stressors are, even those that we experience as childhood, and how they impact our health functioning later in life, okay? So, and also the immediate. So if you have a high degree of stress, you have a much higher likelihood of getting the flu, of getting a cold. And if those stressors are complex, then you have a much higher likelihood of contracting an autoimmune disease, okay? You'll notice also that if you know someone who has experienced significant amounts of stress. They probably got sick maybe 4 or 6 weeks later, like after the onset of the stressor. And this is those types of stressors that don't go away. Okay. Then probably 6 months to a year later, they did end up having some type of really interesting autoimmune disorder, right? And that could be, I mean, there are hundreds of different autoimmune disorders. This is why it's so common for kids to be diagnosed with asthma who don't have a family history of asthma, because that's one of the common autoimmune diseases that occur with chronic and with toxic stressors. The book, which I'm sure many of you are familiar with, The Deepest Well, amazing talks in beautiful language about how all of this occurs. So the cool thing though is there are protective factors, okay? And for the most part, they are free, okay? So they're what I call the big three, okay? Which all of you are aware of these things, and these are also the things that we tend to not do the most. Do you have any guess of what the big three are? Sleep, diet and exercise. You got it. Yeah, absolutely. Proper nutrition and exercise, right? Okay. Then the fourth, and these aren't in no particular order of importance, although I have to say sleep would probably be one at the top, because lack of sleep is going to cause anxiety, and that increases stress and likelihood of negative health outcomes. Mindfulness is number 4. Number 5 is mental health care. And number 6 is healthy relationships. So besides mental health care, the other 5, well, you have to pay to eat, I get that. But they are things that don't cost any money. So those are the 6 protective factors for helping to mediate some of significant health outcomes when you're engaged with toxic stressors, you and or your students. Okay, questions about that? Okay, so a little more on toxic stress. When the bear in the classroom also comes home. Okay, so as I was alluding to, if there's a high degree of stress that's happening at school, and you also go home and that high degree of stress comes home with you, either because you brought the bear home with you, or because there's a new bear that also lives at home, then that becomes a really difficult situation. And when we flip it, it's the same with our students. So if we have students that are experiencing toxic stress in the environments and they bring that to school with them, you're going to be finding a lot higher instances of behavioral issues that then can transfer on to you, especially if you're not engaging in good quality self-care. Okay. Nadine Burke-Harris talks about this a lot. And what I'm realizing just within my own life is my parents are aging, and I'm like now in a sandwich generation. So I have to make sure that I do whatever I can to try to mediate my own stressors, because work tends to be more of the place where I'm finding a lot less stress and much more opportunity for creativity. Where then going home there's a lot of stressors to deal with. So our overall mood is easily read by others and influences the behavior of others. You probably noticed this, and most of us are we're very driven by our sense of sight, because again, it's very closely connected with the amygdala, our fight and flight responses. So, and I'm sure you read the room, right? When you're coming into a room, if you're coming into a staff meeting, or maybe one of your if you're a parent and you're going to one of your kids' events, oftentimes you're kind of like going in and you're reading the room. You're reading to see what the emotions and the expressions are of people who are around you. That's going to help dictate how you're going to be responding, and if you need to have your guard up, or if you can have your guard down, if you're going to be feeling in a position of being a little bit more relaxed, or if your stress response will then be activated. What research has found is that our emotional responses are 5 people deep. So whatever mood that you are, if you're in a room where there is a lot of fun, a lot of excitement, that is going to rub off 5 people deep. So when you're in the line at Starbucks, for example, then you're going to be particularly nice to the barista, who then is going to be hopefully maybe more particularly nice to all of those customers, for example, and then so on and so forth, if that makes sense. So it's the same thing when we're in the classroom. So however our mood is when we come into the classroom is going to be impacting what is the typical classroom size here? Is it 22 to 26 students and vice versa? And you're only one person. So if you're finding sort of that negativity with your students or difficulties with your students, that is then impacting all of those kids and then 5 people deep from there. Wow, it seems like a lot, doesn't it? Okay. Again, the good news is that being aware of that process is the first step to helping to mediate that and coming back to what we know, coming back to what is in front of us, what is reality, and not necessarily what our judgments are, will help to make that difference in our mood as well as our interactions with those people that we work with and work on behalf of. Something also interesting too is the fight or flight response. So I don't know that this gets talked about enough. So I'm going to end with this and then we'll do a closing practice. Is that when you're in the classroom and your stress responses have been activated, and if your natural reaction would be to fight or flight, but you're stuck in a room with 22 to 26 students, that can be really paralyzing. And I think that is something in education that needs to be brought to awareness. I'm not sure that I have a solution for you other than to say that awareness of knowing that oftentimes is going to be against what your natural reactions are because you have no way of escaping. Does that make sense? Okay. Any questions before we move into a closing practice for today? Okay, great. Okay, wonderful. So again, find yourself in a comfortable position, whatever that means to you. And again, just feel free to either close your eyes or lower your gaze or just find a fixed point for your attention. And if you will, just repeat the following words to yourself. May I be happy. May I be well. May I be peaceful. May my near and dears be happy, be well, be peaceful. May my strangers and acquaintances be happy, be well, be peaceful. May my difficult ones be happy, be well, be peaceful. May all living things, including the earth, be happy, be well, be peaceful. May I be happy. May I be well. May I be peaceful. Extending myself gratitude for the person who I am, for the challenges that I face, for doing the best that I can, and being the person who I am. And when you're ready, whatever that means to you, again, just re-engage into our space together. May you all be happy, well, and peaceful. Thank you for this hour and this opportunity.
If you have 30 more seconds to say what our next step should be if we're interested, and I mean, this buy into what you're saying. What's our next step?
Start practicing. find something that we talked about today, or maybe something you knew before we even had this conversation today, and just begin to start implementing those small increments of practice within your day. And be kind and gentle on yourself throughout the process, whether you decide to do this or not. Yeah. Thank you. Thank you all very much.
I don't want to interrupt the flow of happiness with nothing, so I'll say that.